Hey, good evening, everyone. Thank you so much for joining us from across the Greater Washington and beyond. My name is Rabbi Hillel Schaps. I'm the director of the Greater Washington Community Kollel. We welcome Rabbi Winter as well, the Rosh Kollel, and everyone who's here this evening. Um, I want to just begin by thanking Rabbi Dr. Micha Siegelman, who was really the brains behind this. The idea came from him, and he put in a lot of effort to make it happen and really pushed it along with a small team. But the Greater Washington Medical Halacha Chaburah was really his idea, and we really appreciate that he made this happen. I also want to thank him for sponsoring this evening's shiur, Lilui Nishmas, his father, Yisrael Lev ben Yechiel Nata, Zecharnu Livracha, Shama Sher having Aliyah. The goal of this is to increase our knowledge of halacha in areas relating to medicine, and but beyond that, also to create a bit of a community around this topic. And we have a nice email list now, and we have a WhatsApp group that you can join. That hopefully, as we go, that will turn into a forum for discussion and for promoting other learning opportunities that relate to this. We're very fortunate to have Rabbi Yitzhak Grossman deliver our shiur tonight, and he will be giving the shiur hopefully monthly. Rabbi Grossman is, first of all, a cherished member of the Greater Washington Community Kollel. He spent 12 plus years, I think, with us here in Greater Washington. And although the Grossmans recently moved to New Jersey, Rabbi Grossman remains a valued member of the Kollel and still delivers weekly shiurim for us. Thank God for Zoom. And Rabbi Grossman really is, as you'll see, an excellent and talented teacher, but he's an expert in many areas of halacha, specialty in choshen mishpat, monetary law. He's a dayan on numerous batei din at different times. Rabbi Grossman received his micha from Reb Zalman Nechemia Goldberg, and it's a bit of a reunion here to get together again, and we're looking forward to hearing from Rabbi Grossman. He plans to speak for about 45 minutes to an hour. We're going to hold any questions till the end, till he finishes his presentation, and then you can share them. If you want to put them in the chat, then they can be saved for the end, or you can just ask them once he's through with his talk. So I'm going to turn over the floor to Rabbi Grossman.
Thank you so much, Rabbi Sheps. I want to reiterate my thanks to both my colleagues, and good friends, Rabbi Winter and Rabbi Sheps, for putting this together on the Kohl's end, and my good friend, Rabbi Dr. Micha Siegelman, along with the other members of the committee, Adam Srag, Reuven Shor, Aaron Cypress, for putting this together. In a certain sense, I have the easier job here because even though I, of course, have to put in a lot of work to prepare the material, it's learning Torah, and it's what I enjoy it, and it's pleasurable. Learning Torah at its best is very enjoyable, and the committee and my colleagues in the Kollel did the hard work of the organizing and the technical work, and I have a great deal of gratitude to them for putting this together and to all of you for attending. As Rabbi Shap said, the basic outline of the program is going to be where this year we're going to be studying Choli sheyesh bo Sakanah, the question of the contours of the law that if a person is gravely ill, his life is in danger, yesh bo Sakanah, we can be machal Shabbos, we can desecrate the Shabbos, and most other prohibitions in the Torah. We can discuss the parameters of that. In the future, we may move on to other areas of medicine and halacha, but for our first group of shiurim, we're going to be discussing the definitions, the laws, the theory, and the practice of Choli sheyesh bo Sakanah, a person who is gravely ill and his life is in danger. So we'll begin by taking a look at the Talmudic source, the derivation for the rules that the derivation for the rule that we can be machal Shabbos, we can desecrate the Shabbos, or do almost any other avera to save the life of a person who is gravely ill, whose life is in danger. So the Talmud, as you'll see in the handout, the Talmud offers a variety of different sources. It's one of those halachas. It's a basic halacha. We all know the halacha that pikuach nefesh is docha Shabbos, but what's the source? So the Gemara brings a variety of different suggestions. The two that are, I think, best known and that have the most traction in later halachic sources, one of them is one of them is simply a svara, simply a logical argument that it says V'shamru v'nei Yisrael es Shabbos, the Jews should keep Shabbos. It's based on a pasuk, but it's kind of an intuitive argument. Chalel alav Shabbos achas, k'dei sheyishmar Shabbos es harbe. In the long run, better that we desecrate one Shabbos now to save his life. This way, the person can survive and keep many Shabbosos in the future. That is one idea. That's Rav Shimon ben Menashe. The other famous idea, the Gemara's final idea, which is the one that the Gemara endorses as the primary source for the law, is v'chai bahem. The Torah says that you should do my mitzvahs v'chai bahem and live by them. V'chai bahem, kipshuto, one might think it means that v'chai bahem, and some commentaries explain it this way, you'll live eternally, you'll get eternal life, life of the soul. But the Gemara interprets v'chai bahem quite literally. You shall live by them in this world. The mitzvahs are given for you to live. V'lo sheyamas bahem, not that you should die. Mitzvahs don't apply in general where they would cause you to die if you try to keep them. As I said, that's the Gemara's conclusion. The Rambam, when the Rambam brings the law that a chola sheyesh bo sakana is that a chola sheyesh bo sakana, we violate the Shabbos or do anything else, he brings the drasha of v'chai bahem v'lo sheyamas bahem. And the way the Rambam puts it in his inimitably eloquent style, he says, She'ein mishpatei haTorah nekama ba'olam. The laws of the Torah are not, God is described as kelkana, a zealous God, but the laws of the Torah are not meant as nekama, they're not meant as vindictive and as hurtful. Ela rachamim v'chesed v'shalom ba'olam. The Torah is meant to be a Torah of compassion, of chesed, of peace in the world. Torah that leads to grim and terrible outcomes, that's not the true Torah. The Torah is supposed to be rachamim v'chesed v'shalom ba'olam. Now, that's very inspiring, but as we'll see, there are going to be cases where the Torah does mandate things that we might see as being quite grim. But nevertheless, broadly speaking, in general, the rule is the Torah is not meant to be nekama, it's not meant to be misa. The Torah is meant to be a Torah of life, of rachamim, of chesed and shalom. And that is the final drasha of v'chai bahem v'lo sheyamas bahem. As I said, the halacha itself is very well known. This is, I think, a pretty much universally known halacha that preserving life overrides almost all other laws in the Torah. I remember many years ago I saw there was a human interest piece in the New York Times. It was written by a surgeon. He had a patient who needed heart valve replacement, and the surgeon, this is decades ago, but the surgeon, I don't know the current state of the art, but the surgeon told the patient, who was a Hasidic or Haredi Jew, he said, there are two options. We can use an artificial valve or a pig valve. Those are the two options available at the time. He said, normally, the current state of the art, I'd recommend the pig valve, but I know that Jews don't do pig, so you can get away with an artificial valve. So to the surgeon said, to his great surprise, his Hasidic-looking patient said, no, I want the pig valve. And he explained that the Torah says, v'chai bahem, that preserving life is the ultimate good, and if the pig valve will increase my chance of survival, that's what I want. And the surgeon was quite impressed. He thought these Hasidic Jews, I guess, were primitive, simplistic, absolutist moral thinkers. He was quite surprised to hear such a modern and nuanced approach. Anyway, but we know that v'chai bahem, the Torah says that we don't throw away our lives in order to keep the Shabbos. Okay. As I said, even though the conclusion of the Gemara is that the main source is v'chai bahem v'lo sheyamas bahem, but the other drasha, that other idea that it's better to do a kind of a utilitarian argument, it's better to sacrifice Shabbos observance once, right now, in order to retain the ability to keep Shabbos in the future, that has some traction in the poskim as well. There are a number of different halachic contexts in which poskim bring that as the rationale for saving someone's life. One important application of this is a very interesting analysis of the Ramban. There's a major discussion in the Rishonim, going back to the Gaonim, more than 1,000 years ago, about whether the idea of Chola sheyesh bo sakana, the idea that we desecrate the Shabbos to save a life, does that apply to a to an unborn fetus, to an unborn fetus who's, does he have the status of a person? Do we say, are we Machal Shabbos to save his life? If a woman is in, if there's fetal distress and the only way to save the fetus's life is Chil Shabbos, are we Machal Shabbos for a fetus? So as a practical matter, the halacha generally is yes. The halacha typically presumes, the Rishonim say already, typically any case of fetal distress is going to involve some risk to the mother. Even natural childbirth is considered to be Chola sheyesh ba Sakanah. We know that if necessary, we drive a woman to the hospital on Shabbos. We try to use a non-Jew, but if you have to, you can drive the woman yourself. Even natural childbirth, normal, routine, uncomplicated childbirth is considered Chola sheyesh ba Sakanah. So it's not hard to imagine that if a woman is in danger of suffering a miscarriage and something's wrong with the fetus, that certainly will commonly endanger the mother. So as a practical matter, the post can pretty much agree that you're always going to be Machal Shabbos. But the question is the theory behind it. Are we actually concerned enough about the fetus that we're Machal Shabbos to save the fetus's life? Or is the concern solely for the mother? So we know that the halacha takes a very subtle and gray attitude toward the status of a fetus. Unlike some other religions or moral systems that treat the fetus as an absolute person with all the rights in the context of abortion and so on, as a 100% person, halacha takes a much more nuanced and complex view toward a fetus. There are poskim who say that abortion is murder, but it's a matter of great debate, and there are all kinds of arguments from the halachic literature, the Talmudic literature, for or against the fetus being a person. The Ramban explains the Shita of the Bahag, that based on the Halach Gedolos, a Gaonic work, that although a fetus is not a person that we would in principle be Machal Shabbos for, V'chai Bahem V'lo Sheyamus Bahem may not apply to a fetus. The Ramban says nevertheless we will be Machal Shabbos to save a fetus in distress. Why? Chalel of Shabbos Achas, Shemer Yishmer Shabbos Harbe. The rationale the Ramban tells us for Machal Shabbos to save a life is because in the long run he'll keep many more Shabbosos. The fetus as well. He might only be a fetus now. He might not be a full person, but he will have the chance to keep many Shabbosos in the future. And therefore, the Ramban says the reason that Mutar L'Chal Shabbos Achas can broaden the scope of the rule that we're Machal Shabbos to save lives, even for a fetus. He might not be a full person, but he's a potential person, and he's a person who will hopefully keep Shabbos in the future. This can be taken too far. Contemporary poskim of the last few decades discuss the question of whether you can be Machal Shabbos to save the life of a fertilized egg in a laboratory, in a fertility clinic. If the freezer goes off on Shabbos, if something goes wrong, and there's a need to be Machal Shabbos to save the life of the life or whatever it is, to save the viability of the fertilized egg. Can you do that? I mean, he's not a person yet, certainly, but if he eventually is implanted in a woman and the implantation is successful and the baby makes it, he can keep many Shabbosos. There, the post can say that's too far. They point out that the success rate is not that high. Again, not clear why that matters. A baby who's only a suffix, the fundamental rule is for a suffix, for a question of doubt, we're Machal Shabbos also. But post can feel that that's already, even with Mutar L'Chal Shabbos Achas, that's going too far. To say we can save potential life, it's not even really life at all. It's not been, post can generally considered a pre-implantation embryo to not really have any status of person. There's no issue of abortion. You can destroy surplus embryos. Some of the Christians have issues with that. There are some other ethical systems that have a problem with fertility medicine in general. One of the problems is that you have to destroy surplus embryos sometimes. Halacha, though, the consensus generally is that pre-implanted embryos do not have a very significant halachic status, and therefore the post can say you can't be Machal Shabbos to save a fertilized egg. But a fetus, the Ramban explains, the Bahag holds, you can be Machal Shabbos because Mutar L'Chal Shabbos Achas, in order that he can be Mekayim, hopefully he'll survive and make it to adulthood and keep Torah and mitzvahs, and that itself is a reason for Machal Shabbos to be Machal Shabbos to save this fetus. What about a person who isn't going to make it to next Shabbos? He's even if we are Machal Shabbos to save his life, He's not going to make it more than 2 or 3 days. It's Monday. He's not making it past Thursday. We're nearly nearly certain he's not making it past Thursday, even if, well, I mean, it's Shabbos now. In other words, we've been Machal Shabbos now to save him, but the Yom Kippur to save him or something, but he's not going to make it to Shabbos Harbe. He's not going to make it more than a few days. Can you be Machal Shabbos to save him? The halacha is yes. The Shulchan Aruch rules that we are Machal Shabbos to save such a fetus as well, and to save such a person or fetus as well. The Bir Halacha explains why. The Chavetz Chaim writes in his Bir Halacha why he's not going to keep Shabbos Harbe. He's not going to make it more than a few days. Says the Bir Halacha, we have to take Shabbos Harbe more broadly. We don't really insist and require that he keep many Shabbosos. The mere fact that he will keep other mitzvahs, he'll do other things of religious value. The Chavetz Chaim quotes the Meiri, one of the Rishonim, that he can do tshuva. Tshuva is even internal. He can repent and he can confess his sins to God. Even that's of great value. Even that's enough of a reason. To Machal Shabbos, because even that's something that's infinitely valuable, that's supremely precious in the eyes of the Torah. The Bir Halacha goes on and says that the whole point is really superfluous because Mutav L'chal Shabbos Achas is not the only or even the primary reason. The primary reason is V'chai Bahem, that the person's alive. Life itself, by definition, is precious, without the argument of Shabbos Harbe. But Lamaisa, the poskim do bring in both these points. The poskim do weigh both these considerations. First of all, we have the utilitarian point that he'll keep more Shabbosos, so it's worth it. And second, B'chai Bahem, that human life is considered essentially in and of itself to be supremely precious, and that itself is a reason for being Machal Shabbos in order to save life. So now the question we have to ask ourselves is, what is the definition of Yesh Bo Sakanah? So there are actually a number of different facets to this question. The question we're going to focus on today is, how do we define Sakanah? What does Sakanah mean? Danger to life, danger to limb. How do we define danger to life? In future discussions, we'll consider questions like trust and how do you verify, and which doctor's opinion, how do you weigh conflicts among doctors, and how do we look at long-term danger. We're not going to focus on these questions tonight. Tonight we're going to focus just on the core question of what is the definition of Sakanah. So in the Talmud we find really two definitions. We find one definition, we find kind of an enumerated list of specific conditions that are considered yesh bo sakana. The Talmud enumerates certain criteria of injury, certain conditions, which it defines as yesh bo sakana. It also gives us a more general rule that we do omed, that we consult. Tzricha omed. There's a certain category of maka, of injury, of wound, that's tzricha omed, that it requires a medical evaluation. We consult medical professionals, we consult experts. If they tell us this condition is dangerous, then it's dangerous. If they tell us it's not, then it is not. We'll discuss the details of these conditions and how they apply in contemporary times soon. But before we get into the list of conditions, I mentioned before the concept of sakanas aver, danger to limb. If a person is going to lose a limb, physically lose a limb will be destroyed, an organ will be destroyed, or lose I'm using organ very colloquially, I'm not using the specific medical definitions of organ and limb and so on. Or a person will lose the functionality of a limb, like eyesight or the use of his hands or legs. So what's the halacha in these cases? So the Gemara clearly indicates that is generally not considered sakanas nefashos and not grounds for being machal Shabbos. The Gemara says eyesight, the eyes are an exception for reasons we'll discuss soon. But the eyesight is an exception. But the implication is that eyes and eyesight are the exceptions that prove the rule. The Rush, the Piskei Rush says, we see from the Gemara, Sakanas Aver is not grounds for Chil Shabbos, for an Isur D'Oraisa. Isur D'Rabbanan, there are dispensations. That in general, by the way, is something we should be clear about. The question of whether something is Chol Sheyesh Bo Sakana, danger to life or not, is relevant primarily to the question of whether we can violate the Shabbos with a malacha d'oraisa, with a biblically prohibited activity. Even for a Choli she'ein bo Sakanah, as long as he's seriously ill, even if there's no danger whatsoever to life, there are many dispensations to do Chil Shabbos with a rabbinic prohibition. For example, asking a non-Jew to do malacha. That we routinely do. We routinely ask non-Jews to do malacha, even though we can't do that for a regular healthy Jew. We can do that for a Choli she'ein bo Sakanah. We're not going to get into the details of Choli she'ein bo Sakanah, what's permitted and what's not, what kind of drabanans. But just to be clear, our discussion tonight and our discussion in general in this group of shiurim is going to be what's considered Choli she'esh bo Sakanah, which is relevant primarily for the question of when can we do a malacha daraisa. Malacha drabanan is much more lenient, and in practice, in many cases, you can get away with doing malacha drabanan. Our question tonight focuses on malacha daraisa, the Rosh Paskins, and this is pretty much universally the universal consensus of the poskim. You cannot do Chil Shabbos daraisa to preserve a limb, function of a limb, an actual limb. Cannot do that, with the exception of eyesight, which we'll discuss later. But in general, you cannot be Machal Shabbos to save a limb. Again, we mentioned earlier that the Rambam talks about how the Torah is a Torah of life, not of Nekama, and it's a Torah of Chesed and Rachamim and Shalom. It might sound very harsh, but even if a person is going to lose a limb, lose a leg, lose a hand, you cannot be Machal Shabbos for a Malacha Daraisa with a Malacha Daraisa to save an organ like a hand. Again, in practice, depending on why he's losing a hand, it may very well be Choli she'esh bo Sakanah on other grounds, not because of the hand. If a fellow has, someone cuts off his hand, then the blood loss, the shock, the infection, many of those things would qualify as Choli she'esh bo Sakanah. So in practice, in many cases where some kind of trauma or some kind of horrifying disease is taking out an arm, in many cases that would qualify as a Choli she'esh bo Sakanah on general grounds. But the loss of a limb per se is not grounds for being Machal Shabbos daraisa. You need Sakanas nefashos. You need v'chai bahem v'lo sheyamas bahem. It has to be literally a matter of life and death. A substantial loss of bodily function or of a part of the body is not enough to be Machal Shabbos with an Isser daraisa. There was a fascinating case that arose 100 years ago. It was discussed by a number of the Gedolei HaPoskim of the time. There was an infant who was born with some kind of severe deformity of the legs. I tried looking up exactly what it was and figuring out from the treatment plan. Not sure exactly what it was, but the infant had a severe deformity of the legs. The physicians at the time said, in their professional opinion, this could be treated either with a cast, some kind of casting procedure, or possibly with surgery. It was possible to treat this, but the window for treatment was very narrow. The baby was still very flexible right when he was born. If treated immediately, within a few days after birth, the condition could be corrected. If, however, they would wait until after the bris milah, wait 8 days till after the bris milah, the window would close. The possibility of treating this condition would disappear, and the baby would be condemned to a life of deformed legs. He would lose some function in the legs, and he would be embarrassing, and he would lose some function in the legs apparently. So the question arose, the problem was, if they do the treatment right away, it would be impossible to do the bris on the 8th day. The bris would have to be postponed. The question was, can we deliberately do this treatment a few days after birth, knowing that by doing so, we are foreclosing the possibility of doing the bris on the 8th day. So the Torah is a Torah of Rachamim, of Shalom, and of Chesed. And in practice, all the poskim who discussed this question were either outright lenient or inclined toward leniency. No one that I'm aware of actually said it was usher. But the analysis they offered was different. The various analyses they gave were different. The different Malkiel Tenenbaum, discusses what he actually said it was mutter. But when he discusses why, he initially proposes, well, Milah is an important mitzvah, but you have to, but condemning a kid to a lifetime of deformed legs, that's a lot to ask. Abdi Nezer actually said, yes, that's a reason to push off the Milah. That itself is a reason to push off the Milah. The fact that you don't have to pay an unbearably high price to do a mitzvah zaseh, a positive commandment, and condemning a child to a life of deformity of the legs it's too high a price to pay for the mitzvah of Milah. The Divrei Malkiel, however, rejects that argument. He says that's not a justification for postponing the Milah. He says the halacha is it's universally accepted halacha in Hilchos Shabbos. We are not machal Shabbos be'isur daraisa for Sakanah saver. A person is going to lose a limb. That's terrible, but you can't be Mechal Shabbos for that. Says a different Malkiel, the same thing would apply to Bris Milah. You are not Sakanas Aver. Losing an Aver is not a reason to push off Milah. You need Sakanas Nefashos to override a mitzvah daraisa, and Sakanas Aver is insufficient. The different Malkiel's assumption that Sakanah Aver is not enough for a mitzvah zaseh is very debatable. It's a very dubious assumption because we're talking about Chil Shabbos, actively violating, desecrating the Shabbos. Simply by inaction, not doing a mitzvah is much more lenient. So one could definitely argue that Sakanah Aver would be enough for that, but the different Malkiel runs with this idea of Sakanah Aver not being grounds for setting aside a mitzvah daraisa. It applies even to a mitzvah zaseh. If by passively declining to do a mitzvah, you are that if that's the price you have to pay to avoid Sakanah Aver, you have to suffer the Sakanah Aver in order to do the mitzvah. L'maisa, the different Malkiel was lenient on other grounds because you're doing the procedure before the 8th day. The mitzvah of Milah isn't here yet. There are other reasons to be makel, but the different Malkiel, in terms of this reason, he said Sakanah Aver not grounds for violating a mitzvah daraisa. So Sakanah Aver not, you need a danger to life. What is considered a danger to pikuach nefesh? Well, what is considered a sakanas nefashos, a danger to life that justifies Chil Shabbos? So at one point the Gemara says, Omet, we asked physicians about the nature of a wound, about whether someone is sick and needs food. The Gemara in Yoma says, the Gemara in Avodah says, the various Gemaras that discuss this make it clear that that besides all the specific examples it gives, we consult physicians and about anything that doesn't fit into one of the predefined categories of sakanas nefashos, we consult experts, professionals, and we follow what they say. But in addition to that, the Gemara gives us, as it often does, the Gemara gives us a number of specific cases that it tells us are defined as pikuach nefesh. One of them is the Gemara says gav hayad and gav haregel, the back specifically of the hand and the back of the foot. It's not clear exactly what part we're talking about, but the back as opposed to the front of the hand and the foot, an injury, a traumatic injury over there is automatically considered is sakanas nefashos, and we're machal Shabbos. One example. Another example, the Gemara says pedata. The Gemara says that what is pedata? Rashi says the Gemara says about pedata. The Gemara says that the Amar Shmuel Hai pedata. Rashi says it's a wound caused by a sword. Sakantahi, it's pikuach nefesh, machal es Shabbos, and it's grounds for Chil Shabbos. Now, obviously, if it reaches internal organs and causes infection, obviously it's grounds for you don't need Shmuel for that. But the poskim seem to understand that pedata means any wound caused by a sword, and the poskim say, Beis Yosef, based on Hagos Amanios, say not specifically a sword, any injury to the body caused by an iron tool, automatically is defined as pikuach nefesh, even though it's not gav hayad and gav haregel. Injuries caused by iron are defined, iron, steel, presumably are defined as pikuach nefesh. So we have gav hayad and gav haregel. We have injuries caused by iron. Another one the Gemara gives is makkah shel halal, a makkah that reaches the bodily the internal part of the body. We think of that maybe as the abdominal cavity, but it refers to other areas of the body that spatially are considered internal as well. The Gemara has an intricate discussion about the teeth. It says anything inward of the teeth is considered internal, outward of the teeth is considered external. What about the teeth themselves? The lips, the teeth. The Gemara has questions about that. Where is this line between internal and external? But the Gemara has this idea that an internal injury is automatically considered because it's sakanas nefashos. External injuries generally are not, or at least are not, until you have reason to believe that they are. So again, the Gemara compares gav hayad, gav haregel, back of the hand and foot, makkah shel halal, what literally meaning internal injury, although not the same definition as the modern medical sense of internal injury. Pedata, which is an injury caused by a sword. Any iron, as understood by the poskim. Certain types of fevers, the Gemara says. Ishtat Zamirta, a certain type of burning fever, is like makkah shel halal, also considered Choli sheyesh b'Sakanah. We'll discuss soon how these all apply b'zman hazeh. But the point is, again, taking a step back, the Gemara gives us a number of specific conditions that are considered pikuach nefesh, and these are all brought by the poskim. All these things are brought by the poskim, certainly the early poskim. One last one we'll mention is injury to the eye. We mentioned before, the Gemara says that the Gemara brings different opinions about whether the eye is considered pikuach nefesh or not. The halacha is, the maskana is that it is. That an injury to the eye that needs treatment is considered sakanah nefashis. It's considered chola sheyesh b'sakana or mechal Shabbos for it. Why? So the Gemara gives a curious explanation. The Gemara says, Shuriyana de'ena ba'ovanta deliba talu. The eyes, some type of tendons or fibers from the eyes are connected to the heart. So the heart obviously is danger to the heart. Is chola sheyesh b'sakana. The eyes are somehow connected to the heart, and therefore the eyes are considered chola sheyesh b'sakana. We mentioned before, the Rush infers from that. If the eyes were not connected to the heart, then you would not be mechal Shabbos for the eyes. So the Rush infers it's a kind of aver, even an aver, even a limb, a specific organ that's as important as the eyes, as crucial to a person's well-being, as important as the eyes, are not grounds for mechal and Shabbos be'esur daraisa. And therefore, the eye is a special exception, and the eye is a special exception. Other than that, an aver is not grounds for sakanah nefashis. I mentioned before, and I'll mention this again, that again, all these things that are or not sakana, if the physicians say that based on the specific details of this injury, this wound, is grounds for pikuach nefesh, then of course it is. So people asked in the chat about infections and gangrene. There's no question those things the modern poskim say would be considered pikuach nefesh. Anytime physicians tell us that this wound, it might not be a serious wound, it might not be gavayad, it might not be iron, it doesn't reach the halal, but there's a danger of infection, absolutely will be mechal Shabbos. Rabbi Avram Sofer Abraham in the Nishmas Avram says that the eyesight. There's a major discussion about whether eyesight bisman hazeh is considered pikuach nefesh or not. If there's no danger to life, it's just a question of eyesight. Do we follow the Gemara and say that eyesight automatically is defined as pikuach nefesh or not? We'll discuss that in more detail soon. But he says, parenthetically, or not parenthetically, but he says, of course, in practice, he says any sudden change to vision can be a symptom of something much more serious that can be life-threatening. So in practice, he says, someone who has a sudden change or loss of vision needs to go immediately to seek medical care and should be mechal Shabbos be'esur daraisa, because even if the eyesight per se is not considered pikuach nefesh, it can be an early symptom of conditions that are considered pikuach nefesh. There's no question if there's a possibility of gangrene and so on, then these things would be pikuach nefesh. The fundamental question we have to deal with here is how do we apply all these halachas l'maisa? Gav hayad and gav haregel. Someone has a scratch on the back of his hand, needs a Band-Aid. Is that grounds for Chol Shabbos? We're not talking about tetanus. Tetanus is certainly a question, Rabbi Abraham says, of pikuach nefesh. If it's tetanus that could be, he hasn't had a tetanus shot, there could be tetanus, that's certainly pikuach nefesh. But putting that aside, assuming it's not tetanus, it's simply a scratch on the back of the hand, or a scratch from a knife. Person was cutting his steak and he scratched his hand with his knife. Do we really consider that chola sheyesh b'sakana? So the fundamental question here is, do we automatically defer blindly to the assertions made by Chazal that all these conditions are irrefutably considered chola sheyesh b'sakana, or do we say that we have to follow the best medical opinion that we have? So a number of achronim, earlier achronim primarily, say that anything Chazal defined as dangerous is chola sheyesh b'sakana. We do not change the halacha. It remains the halacha. If Chazal described a specific condition as chola sheyesh b'sakana, we treat it as such, even if the contemporary physicians say otherwise. The Bach says this, the Pri Megadim says this, the Pri Megadim says, the way he puts it is, that we're mechal Shabbos for anything mentioned in this list. He's going on the list of the Shulchan Aruch, a makkah of iron, of barzel, certain types of blistering, certain types of fevers. All these things are defined as chola sheyesh b'sakana. We dismiss any modern medical assessment to the contrary. We say sheker omrim because they're not right. They're saying something that's not true because the Gemara tells us it is. Even though we sometimes say in halacha in various contexts, nishtana hateva, that natural things have changed, that the reality are different today than they were in the time of Chazal. Says the Pri Megadim, we don't say this today. We don't say this in this context. In this context, anything that Chazal defined as Sakanah nefashos remains Sakanah nefashos, and we don't try to second guess anything that Chazal said. The poskim say this in various contexts. The Kitzur Shulchan Aruch in the Mincha Shabbos makes the same point. He says eyesight. He says eyesight. We don't think today, unless it's a broader condition, we don't think eyesight is a loss of eyesight or a loss of vision is actually going to kill somebody. He says if the Gemara says it, perhaps at least he says we don't change the din. And he also, following the Pri Megadim, following the Bach, makes the same point. Anything that Chazal said is dangerous, remains dangerous, and we don't change the halacha. Mishnah Berurah brings this that in various contexts that we don't change the halacha. The poskim actually argue specifically about eyesight. Poskim actually argue about this, about whether a case of a danger to eyesight that clearly by the best, all the doctors will tell you there's no danger to life. They talk about things like detached retinas and other types of damage to the eye that clearly are not broader problems. The worst case scenario is that he'll lose sight wholly or partially in one or both eyes, but there is no question, according to modern medical opinion, that he will not be in danger of death. So can you be Machal Shabbos, Isur Daraisa, to save his eyes? Again, very often you can find you can avoid Chil Shabbos Daraisa and do Drabanan, but assuming you have to do Chil Shabbos Daraisa, can you do Chil Shabbos Daraisa to save somebody's eyesight? So a number of poskim say that's what the Gemara says. So on the one hand, the Gemara says that eyesight is automatically defined as pikuach nefesh. On the other hand, some achronim learn, including Rabbi Yosef, Rabbi Newerth, author of Shmir Shabbos Kilchasa, they say that even the Sakanah of the Gemara, they distinguish between physical trauma to the eye, destruction of the eye, and loss of eyesight, but where the eye itself is intact. Today we can discuss microscopic destruction to microscopic destruction of the eyes, but looking broadly at these two categories, Rav Avadia understands that even the Maskana of the Gemara, that eyesight is automatically defined as dangerous, that's only danger to the physical destruction of the eye, but loss of eyesight reverts to ordinary Sakanas Aver. You cannot be Machal Shabbos Isur Daraisa to save somebody's eyesight. And however, Rav Yashuv, on the one hand, understands, he says that Maskana of the Gemara, all types of the loss of eyesight, even without physical destruction to the eye, are considered pikuach nefesh, and you can Machal Shabbos for any danger to eyesight, even without physical destruction to the eye. But Rabbi Yashuv still was machmer and said that he would not be mekel halacha l'maisa to do Chil Shabbos for a danger to eyesight. They asked him why, if you take the Gemara at face value, that any type of loss of eyesight is considered pikuach nefesh, why wouldn't you allow Chil Shabbos? He said because medical science clearly tells us that that's not the case. For a detached retina, for different types of things which pose no danger whatsoever to the person's life, we have to say nishtana teva. Despite the fact that the Bach and the Pri Megadim and many earlier Akram, Mishnah Berurah said that we don't say nishtana teva, that anything that Chazal said, that anything that Chazal defined as pikuach nefesh, we're mekil and we're machal Shabbos. Rav Avadia felt that we should follow medical science, and if medical science says there is zero danger to a person's life, we would not be machal Shabbos. Poskim go back and forth on this. There are a number of poskim both ways. But again, and this is where Rabbi Abraham says, but Lamaisi, you should be aware, he says, that putting this whole question aside, very often a sudden, unexplained loss of sight may indicate a much more serious problem that beyond eyesight that could be pikuach nefesh. And in practice, therefore, in many cases, you really should go to the doctor immediately. But in theory, it's a major machlokus whether lahalacha lamaisa today we would be machal Shabbos for a pure question of eyesight, where modern science believes there is no danger to life. Would we follow the Talmudic rule that it's considered pikuach nefesh, or the modern medical rule that it's not? Again, modern doctors would probably be aghast and appalled if you tell them I can't be Mechal Shabbos to save eyesight. They would probably think we're crazy. But we have the Torah, even though the Torah is not Nekama and is Rachamim. The halacha is clear that we can't be Mechal Shabbos for mere aver, mere eyesight. The only question is, do we follow the Talmudic rule that eyesight, for reasons we don't fully understand, is connected to the heart and is fully pikuach nefesh, considered absolutely pikuach nefesh, or do we follow modern science that there's no reason to believe that a condition of the eye that we fully understand and is not related to the heart is not pikuach nefesh? That is a major dispute among the poskim, with poskim taking both sides on that. This topic in general, so there's a lot to say about the general question of the conflict between Torah and science. What do we do when there are halachas that are based on scientific assertions that we don't believe today are correct? Do we say things have changed? If we do, does halacha change or not? It's a very, very broad topic. We're not going to tackle it systematically tonight. But within the topic of Choli sheyesh bo Sakanah, there are a couple of other cases that we should mention that also hinge on this question. When the Talmud teaches us things about danger and life-threatening things, and halachas are established based on that, do we defer to the Gemara, or do we refer to the Gemara, defer to the Gemara, or do we follow our own opinions? One well-known and very controversial area is the question of metzitza b'peh, oral suction after a circumcision. Talmud says that it was considered dangerous not to perform oral suction. The baby needed, to have the best chance at life, he needed the mohel to perform an oral suction of the organ after the circumcision. And for thousands of years, that's how Jews did bris milah. In the 19th century, people began to argue that there's no reason to do this. If anything, it's dangerous. It can cause more infections. There's certainly no reason to do oral suction. And many argued we should not do oral suction anymore. It did metzitza. There's no point to it. The problem was that it got tangled up in the general battle between the reformers of the 19th century, who were trying to do away with a lot of the Torah. So the pure halachic question of what to do became inextricably tangled with the battle between the traditionalists and those faithful to the Torah against the reformers. It became difficult to separate out to answer this question independently. But there were a number of Gedolei HaPoskim, great Torah scholars of the time, and not all of them were ones we think of as fire-breathing radicals, who insisted that if the Talmud said that oral suction is necessary to avoid danger, then it's necessary to avoid danger, and we simply ignore the contemporary medical consensus. One strong proponent to this view, who might come as a surprise to some people, was Rav Kook. Rav Kook has a formal tshuva on the topic. He says he doesn't care what the doctors say. The most they can do, maybe things have changed, the most they can do is create a suffix, a question of doubt. Maybe it's not necessary today. Chazal said it is necessary. We will do it until hell freezes over, he said. He doesn't use those words, but he says we will do it because all the doctors in the world can't simply strike a halacha out of the Shulchan Aruch. If not the Shulchan Aruch, the Talmud. If the Talmud says you need it, then we do it, and we are not going to drop it just because the doctors say it's not necessary. Tiferes Yisrael and others took this view as well, that if Chazal said it, even if things might have changed, it's possible. Again, they consider not doing it a leniency, that you don't need it. Today we worry it actually can cause infection, it can transmit certain diseases. That's a separate question. But in general, many poskim were very conservative, were very reluctant to say that a law of the Talmud, and even if it's based on what we would consider an outdated medical assumption, can be changed. And therefore, when it came to metzitza b'peh, many poskim were quite strict and required it, even if we think it's not necessary. On the other hand, there are other halachas in bris milah where the Talmud is pretty much equally emphatic that it's necessary, that we simply ignore and disregard. The Talmud considered it to be necessary to bathe an infant after the milah. Already in the time of the Shulchan Aruch, the Beis Yosef said, in our time, we don't bathe kids even during the week. We don't consider bathing post-circumcision to be such an essential thing to do. So we don't do it anymore. The fact that the Talmud said it's pikuach nefesh and you can heat up water on Shabbos to bathe the child because the child after the milah is considered Choli sheyesh bo Sakanah, we don't think so. It doesn't work like that today. Things are different today. So without any drama, without any fuss, the Beis Yosef and later poskim said, we don't follow the Gemara about that. We just think that according to today's best medical knowledge, it's not necessary. So we're certainly not going to Mechal Shabbos for it. So again, metzitza is kind of a special case because of it, because the way it got enmeshed and embroiled in the whole controversy about the reform. But in general, this is something that's very, very difficult to find it's very, very difficult to find consistent rules to understand when the poskim take something that Chazal said and say, Chazal said it, and it is the law, it is the halacha, and we have no power to change it. And when they say that, and when it comes to medicine, the rabbis were not doctors, as some of the Gaonim said, and we can make our own, we can draw our own conclusions about we can draw our own conclusions about whether certain things are Sakanah Bisman Hazeh or not. And again, it's hard to predict what individual poskim hold. Someone as traditional as Rav Elyashiv was still willing to say that you can't treat blindness, you can't treat a condition that can cause loss of eyesight. Because even if Chazal said that it was pikuach nefesh, our doctors don't think so, and therefore Rav Elyashiv was willing to condemn someone to a life of loss of eyesight because he was convinced that today's doctors are right, and or that things have changed since the time of Chazal. Ad kedei kach, he was willing to rely on modern science and disregard what the Gemara had said in this area. Okay, we mentioned Maka shel Barzel, an injury caused by iron, as understood by the poskim, the pedata of the Gemara. An injury caused by iron is pikuach nefesh. Again, so poskim. First of all, poskim say, does that mean a strong traumatic blow, or even a scratch from iron, even a simple cut from iron? Poskim actually disagree. The Bir Halacha says, quotes Ashar, Rabbi Kiveger, is mesupik. It has a question about whether a gentle blow of iron is still considered, a gentle injury caused by iron is still considered pikuach nefesh. Aruch HaShulchan thinks it's only a strong blow of iron. There's an incredible comment by Rav Asher Weiss, which I find quite flabbergasting. But Rav Asher Weiss quotes a comment of the Tur in Hilchos Mila. The halacha is you don't need a knife for Mila. Any sharp implement will do. You can use ceramics. You can use. They discuss lasers, but certainly any physical knife would be. Any physical sharp item would be fine for Mila. The minhag, though, the Torah says the minhag is to use iron. He says that the language he brings, the language of the Torah is that you can use any material, glass, a sharp rock, anything that cuts. Mitzvah min hamuvchar lamol bebarzel. The ideal tool to use is an iron tool. V'nagu Yisrael lamol b'sakin. The minhag is to use a knife. So why? Why is it a mitzvah to use iron? Why is it a mitzvah to use a knife? I would have assumed the mitzvah is because they cut better, because certainly using the technology of the 14th century, the most effective cutting tool would have been an iron knife. That in practice, that was the most, that was the best and the ideal cutting tool that they had. We're the Iron Age, past the Stone Age, and so on. So Rav Asher, though, says something remarkable. He says, Mila was considered somewhat dangerous in the time of Chazal. Ki alecha ragnu kol hayom. The pasuk says that Jews are moser nefesh. They give up their lives. They risk their lives for the service of God. We die every day in the service of God. The Gemara says, Zu Mila. Mila was fatal more often than we would have liked in the time of Chazal. Obviously, we know we push off a Mila if there's a particularly high risk, but all Mila carried some risk, certainly in the time of Chazal, and we do it anyway. Says Rav Asher Weiss, using barzel increases the risk. Every makkah of barzel, every makkah using iron, every injury using iron is chol sheyesh bo sakana. Therefore, we use iron specifically for Mila to demonstrate that alecha ragnu kol hayom, that we're willing to risk our lives for Mila. That's why we use iron, to fulfill the idea of alecha ragnu kol hayom. I find this absolutely mind-blowing. The idea that it's one thing to say Mila is structurally involved Sakanah. We should deliberately court Sakanah by using iron that's more dangerous. We should increase the danger, enhance it, because the Torah said alecha ragnu kol hayom. This seems to me bizarre. Again, one wonders if Rav Asher really believes that iron is actually dangerous. Modern science certainly does not think so. Modern science thinks that if you sterilize the iron and there's no risk of infection, I don't think if it's not rusty and tetanus and so on, I don't think there's any particularly high risk. Maybe Chazal meant one of those things of iron, of tetanus, or of somehow it was infected. Hard to know. But in any event, poskim disagree about what kind of injury caused by iron would be considered yesh bo sakana. And again, Rabbi Abraham and Nishmas Avram wonders about all these things. Do we follow Chazal? Don't we follow Chazal? He says that in his understanding, when it comes to, let's say, Gav Hayad and Gav Haregel, the back of the hand, the back of the foot, he says people, even very pious people, Charedim L'Dvar Hashem, are not Machal Shabbos. He says, Chazal said it's Sakanah. Here, the post can say we follow all the things of Chazal. Why don't we follow it? Again, the same basic tension between when do we follow the Chazal, when don't we follow the Chazal. Hard to know, but the again, the minhag seems to be that in practice, poskim will diverge from Chazal when they consider the scientific consensus reliable enough. In other cases, though, they will say that we have to defer to Chazal. It's not always clear when to apply the former rule and when to apply the latter. I want to just speak briefly, turning now to, again, modern questions. We've discussed we discussed questions about the ancient precepts of Chazal. I want to turn now to a fundamentally more modern question, and this will be our final aspect of the discussion for tonight, and that is mental illness. For many years, illness was primarily physical illness. Even today, advocates for those with mental health problems are quite indignant that there's what they call discrimination in the healthcare system and insurance against mental illness as being a second-class citizen, not be considered really sick, and there's been a considered effort to change this. So poskim of the last couple of decades have grappled with this. To what extent does halacha consider mental illness the equivalent of physical illness in all the various contexts in halacha in which illness is discussed? And tonight our question is, how do we approach mental illness? Is mental illness considered, can it be considered chola sheyesh bo sakanah? So Rav Asher Weiss is one of the leading poskim in the world today considering such questions, considering mental illness. Rav Asher Weiss discusses this at some length, and he is perfectly happy. He is not happy, but not quite the right word, but he is unequivocal. He considers mental illness to be considered chola, and it can be considered chola sheyesh bo sakanah depending on the context. He does, even though I said it's a modern question, he does bring a number of early sources that seem to consider mental illness and the needs of someone who's mentally ill, even if they're, so to speak, in his head, to be real needs and that justify Chol Shabbos. For example, he brings a Gemara. It says that you can. It talks about turning off a light for the benefit. We say the Mehmed Likin. The Mishnah Mehmed Likin. We say if you turn off a light for someone who has ruach ra. What does it mean? Rashi says he has ruach ra. If he doesn't see things, he calms down. Rav Asher thinks that this is a person who somehow is having hallucinations or is seeing things that scare him in his head. And if it's dark and he doesn't see, he will calm down. Again, the Gemara is not saying it's mutter to do that, but this is a discussion according to Rav Asher of what we would call mental illness, and recognizing that there are certain things that can affect the person who is mentally ill. Is this grounds for being Chal Shabbos? So he brings various sources of one of which is a very interesting case of the Chuvas Rashba. He says someone took an oath, it was common back then, a kind of puritanical oath. He wouldn't engage in schok. He wouldn't engage in play and frivolity. He took an oath not to engage in certain practices that are called schok and certain types of entertainment. And this person then suffered some kind of mental breakdown, nishtata, and then he recovered somewhat, nishtata mikzas, but he's still suffering from this debilitating mental illness. One day, when he saw some schok, he saw some play, some kind of skit or something, he calmed down. It helped his condition. The question is, can we be matir the shvua? Can we let him override the shvua in order to engage in schok because we feel it has a therapeutic effect for his mental illness? So he says, he brings the idea that for a chola sheyesh bo sakanah, we can turn off a light for a chola sheyesh bo sakanah. That's considered pikuach nefesh. We can do it. The same thing applies to ruach ra. And even if it's a suffix, he says mutter, because suffix pikuach nefesh is mutter as well. So he says we allow the person to do an isur daraisa. He can violate his oath. He can flout his oath and participate in schok, because it helps him. It helps him with his mental illness, which is Choli sheyesh bo Sakanah. And okay, he brings other sources as well. And Rav Asher is inclined to the view that mental illness can and should be considered a form of Choli sheyesh bo Sakanah. Why? So one issue is that he can cause harm if he has a psychotic break or something like that. He can cause harm to himself or others, or suicide. Certain types of mental illness can lead to suicide. You can think of other examples, perhaps. Eating disorders can kill people, and so on. He brings from the Shevet HaLevi, Rav Osner. He says that the stopping someone from having a complete breakdown would be considered pikuach nefesh. That preventing someone from falling into a complete mental collapse. Rashi says someone who's possessed by a ruach ra, some type of mental illness, as understood by the poskim, or analogous to mental illness. He can drown, he can fall into the river, or he can crash in some other way. This is called pikuach nefesh. Any type of suicide or damage or injury that the person can severe mental illness can cause, that makes it pikuach nefesh, and therefore Rav Asher in general is inclined to the view that we should view mental illness as potentially as Choli sheyesh bo Sakanah as well. Rav Asher then has a very interesting taxonomy of mental illness. He begins by candidly acknowledging that earlier generations were not well versed in mental illness. They kind of lumped together all types of derangements of the mind and didn't systematically diagnose them and explain them. He says, generally speaking, now I am not well versed in mental illness, so I can't speak as to Rav Asher usually gets these things right, but some of the doctors in the audience are in a much better position to comment on than me. Rav Asher's take on mental illness, he says, is that in general, mental illness can be divided into two general groups. What he calls machalot psikotiot, psychotic illnesses, and machalos neurotiot, neurotic illnesses. And the way he explains these two categories, psychotic illnesses, he says, he sees things, he hallucinates, he hears things, he hears voices, that his ability to separate truth from fact, reality from imagination is warped and damaged. And he can certainly cause danger to himself and others in a psychotic episode. There's certainly danger of him causing harm. Medicine can be very effective here, he says. He has to be very careful to take his medicine regularly, he says. And he can take medicine on Yom Kippur because it's essential for him to take the medicine. He doesn't really have to eat, he says. And then the medicine, he says, it's not even eating necessarily, drinking, and so on. So he says basically this you may not need to machal Shabbos or do an Isur D'Oraisa, but this would be considered definitely pikuach nefesh. Then he said, or even if he just has to eat, even if he feels in his psychotic episode he needs to eat, even that, he says, if the doctors evaluate him and say that any kind of stress or pressure can drive him over the edge and can cause him to suffer, even that could be lenient on. If the doctor says he needs it, and if he doesn't do this, his condition can worsen, even that, it could be grounds for eating and drinking. Another point he said, however, he says the neurotic diseases, the neurotic illnesses, he says, what they resemble is not so much disassociation from reality. He says what they are really they're analogous to emotional states, but very extreme ones. Depression, he said what he calls dikaon michad gisa, depression or suppression of spirits on the one hand, euphoria on the other hand, cholim, what he calls du kotviot, bipolar. They go back and forth, he says, from one extreme to another. He says these are generally not pikuach nefesh, he says, although it's true. Extreme depression can cause suicide, he says. And once again, he says these can be pikuach nefesh. We defer to the physicians, even if someone who's suffering from clinical depression, aside from suicide, might not be a risk to his life. That's a big aside. Suicide is a major risk, obviously, of depression. And therefore, once again, Rav Asher says, mental illnesses, based on our modern understanding of them, most certainly should be considered pikuach nefesh, and therefore, once again, Rav Asher says he would, in principle, permit Chil Shabbos, permit the violation of Yisurim in order to treat mental illness. And he says, once again, he winds up by saying, we should follow in these types of things, we should follow the advice of physicians who treat the patient and recognize his specific needs, and therefore we should, that's what we do. He goes on, he has another tshuva he quotes, someone asked him about about mental health professionals who are trauma specialists. Can they be Michal Shabbos to drive to the site of a terror attack or murder and so on if they think it's important to provide mental health services to the bystanders or those involved to avoid things like severe PTSD and so on? Is that considered pikuach nefesh? Is driving a mental health professional driving to the victim of trauma in order to try to ward off or ameliorate or mitigate things like PTSD? Very difficult question, he says. On the one hand, Chil Shabbos is a very serious avera. On the other hand, pikuach nefesh, it's mental health. It can lead to severe mental illness. It can be pikuach nefesh. He says, Lamaisa, he says, even Suffolk pikuach nefesh is Docha Shabbos, Kol Torah Kula, almost everything in the Torah. Unfortunately, he says, we know that trauma can lead to suicide, to people killing their children and so on, other people. And he says it can happen immediately, it can have longer term effects. Lamaisi says at the end of the day, we err on the side of caution. We err on the side of caution when it comes to pikuach nefesh. He says various studies have shown that immediate intervention, immediate without delay, can have a helpful effect. Therefore, we should consider this pikuach nefesh, and in principle, at least, it is permitted for people to drive, for professionals to drive to the site of a trauma incident to provide services. However, he says it is not an immediate and overwhelmingly likely pikuach nefesh. In the worst case scenario, it can lead to pikuach nefesh. It's difficult to define exactly whether whether you really do need immediate treatment. Can you wait a day or so on? So it's kind of a gray area of pikuach nefesh. It's on the border. Therefore, he says you should try to minimize Chil Shabbos, even though, as we'll discuss hopefully later, for out and out pikuach nefesh, we don't try to minimize. We just jump right in and do whatever is necessary right away without trying to cut corners and save time and avoid pikuach nefesh. Here, it's kind of on the edge, and therefore he says we should try to minimize the Chil Shabbos. He says, for example, childbirth. Childbirth, a woman doesn't see herself as really being in grave and imminent danger. She obviously worries about it, but we don't really see women as being in grave danger. On the other hand, Halacha does consider it a significant enough chance to be considered pikuach nefesh. But there, at least, by childbirth, we do try to minimize the Chil Shabbos. You find a non-Jew to drive if you can, and so on. And he thinks that this should be put in the same general category. We do recognize that there is a real and concrete risk to a person's life from trauma, from the mental illness of trauma. On the other hand, it is remote and it is not immediate, and it's not a concrete and an immediate risk, he says. Therefore, you could, in theory, in principle, engage in Chil Shabbos if necessary, but ideally, we should try, if to the extent that we can, we should try to avoid Chil Shabbos D'oraisa. Thank you all again for listening. We'll hold it here for tonight. I'm happy to take questions, or I can look at some of the questions in our chat. But people asked a couple of things I saw in the chat. People asked if the Gemara explains what the connection between the eye and the heart is. Not so clearly. It mentions some kind of fibers or connecting tissue between the eye and the heart. It doesn't explain. I don't know if we can translate what that tissue is or how the damage to one affects the other.
Oh,
So the sound is not working.
I gave everybody the ability to unmute, but that muted you. So you're still muted.
Sorry, I'm not sure how much I was off for, but the Gemara does not explain so clearly the connection between the eye and the heart. It mentions some kind of connecting tissue, but it doesn't give any much more of an explanation. Does barzel mean iron? It generally does. It's generally assumed to mean iron. There are 6 metals in the Bible: Zav, Kesef, and Nechoshes, Barzel, Badil, and Opharis. Barzel is generally understood to mean iron, or at least maybe some kind of iron alloy. But they may have used the term more generally than we do, but I think it is generally understood to be iron. Any other questions anybody want to ask? I'll go through some more of the chat things, but anybody else have a question they want to pose verbally? Couple of other points in the chat. Rabbi Siegelman asks about a fetus that we know for sure will not live long term. So again, we discussed in the beginning that there are two main heterim for pikuach nefesh for a person. B'chai b'hem, that life inherently is precious, and mutav l'chal Shabbos achas, in order to enable him to fulfill Shabbos harbe. Rabbi Siegelman is asking, neither seems to apply to a fetus. If he's not considered life, according to many poskim, you don't have b'chai b'hem, and if he's not considered and if he's not considered, if he won't live long enough to do Shabbos Harbe, and he's only a fetus, he's not, the Mishabur says he can do tshuva and Masim Tovim for the next few days. He's a fetus. He's not going to have a chance to do, he's very young. He's not going to have a chance to do that either. So there is actually some discussion in the poskim. On the one hand, there are those who argue that in a Chanami, Halacha, it would be Aser. It would seem that it would be Aser. There are some poskim who argue that it's mutter. There are some poskim who say that life itself is inherently precious, even if he's not a full-blown Vlad, that he's considered a tzaddik because he's innocent, because he hasn't done any averis. So there are some poskim who seem to incline, who might have arguments for leniency. But in the article I quoted at the end, I didn't label it properly, but after Vasher Weiss, I quoted an article on Chil Shabbos for fetuses. They conclude that Lamaisa, we cannot be Machal Shabbos for a fetus that we know for certainty he won't live more than a few hours, and you would actually not be Machal Shabbos for assuming there's no danger to the mother, and it's just the fetus, and he won't live more than a very short duration. There are those who claim that Halacha, you will not be Machal Shabbos for such a fetus. Someone asked about needles. Is a needle made out of steel or iron? Is that considered makashal barzel according to those who consider it cholash yesh Sakanah? So there are indeed those who say that even a needle apparently would be that even a needle would be included in this category. Rabbi Abraham brings from the Maruk Tir of the Rabbi Yaakov Emden, who says, he points out that even when it comes to injury from iron, if it's very small and it's not dangerous, you can stop it with a band-aid or by putting pressure on it. He says it doesn't need any more treatment than that, and there's certainly no reason to Machal Shabbos for that if you can treat it in a way that doesn't involve Chol Shabbos. Of course, if there's infection, if there's a danger of infection, then that is grounds for Chol Shabbos. I'll just mention one other thing I forgot to mention in the course of the share. One of the examples the Gemara gives for Chol Sheyesh Sakanah is certain types of fevers. But the poskim actually debates whether a fever is grounds for Chol Shabbos. Rabbi Abraham brings Ramoshe a tshuva where he says 101 degrees. 101 degrees, he'd be mater Chol Shabbos daraisa. However, there are some who say that that for that kind of fever, it's not you can't be Machal Shabbos daraisa. Rabbi Abraham himself says, in most cases, a fever in and of itself for a healthy adult is not typically dangerous unless it is really high. He says, in general, if the cholera sometimes, the fever sometimes can be a symptom of some other condition that has to be treated. But a fever itself, unless it's really high, he says extremely high, a fever itself would not generally be considered a dangerous condition for a healthy adult. He says for a child or for an elderly person, he says, then even if it's not so high, that if we don't know what the fever is, that they're more delicate, and we do consider fevers. So again, like many of these things, it has to be assessed on a case-by-case basis. But there are poskim who take the Gemara very literally, apparently, and apply the din of cholash yesh Sakanah to a fever above a certain point, while others apparently are more nuanced and say we look at the big picture and whether we really think that a fever in this context entails some kind of sakana to the person.
Rabbi Grossman, a couple of the questions at the end that just came in kind of relate to what you just touched on at the very end of the shir, which is safek pikuach nefesh. If a person just doesn't have the knowledge, or they don't know, so how does one approach that?
So I hope to discuss these questions in more detail in a future share about what do we do in cases of uncertainty, how doctors' opinions versus the person's own opinions versus neither. So I don't want to say too much of that off the cuff because I didn't really prepare that. In general, the halacha does place a high value on a person's own opinion, even though in some contexts we just dismiss people's own opinions as being wrong. In this case, there is a principle that a person is assumed to be somewhat in tune with his own needs, and that we in many cases we will defer to a person's own opinion sometimes even overriding a doctor. If a person really doesn't know, the doctor he has no opinion, and the doctor and there's no doctor, or the doctor has no opinion. We'll have to get into more details of that, I think, in a future share. But yeah, I don't want to go too deeply into that because I'm not quite sure. Again, somebody asked all the way at the end, should we always err on the side of caution? And so again, this is something that Rav Weiss and the other parts of the essay that I didn't get into tonight discusses at length, and many of the modern posts can grapple with this. On the one hand, the official position is that even a suffix, even a remote suffix, if it's a Choli sheyesh bo Sakanah, then we're machmer. On the other hand, there are poskim who say there are limits to that. There are poskim who say that if the percentage is too low, or if it's or if it's too nebulous or too much in the future, we can't be makel. For example, there's a famous tshuva in the Yehuda. I hope we'll probably get to it on a future occasion. He was asked about permitting an autopsy of someone who had died of a certain condition, because the information we gain from the autopsy would help us in the future with other people with the same condition. He was not willing to be makel because of that. He said, even if we in general believe that the progress of medical science is a good thing and will help other people, if we can't point to a clear, straight connection that we're going to save someone right now, just to say in general somebody will probably be saved in the future, is too tenuous. On the other hand, some poskim said that was in the 17th century or the 18th century when medical science was much more iffy and progress was much less of a sure thing, as opposed to today when the progress of medical science is much more methodical and much more reliable. Maybe it would be different. So we'll discuss hopefully in a future share questions about, is there any limit to how remote a condition has to be before it stops becoming. Some posts can point to the Maggid Mishnah on the context of a woman who's in labor. He says 1 in 1,000. He seems to quote one in 1,000 chance as a cutoff. The question is that really a hard limit of 1 in 1,000, or is that just like an example? Hopefully, we'll discuss these things in a future share. See if there's anything else I can. Yeah, we have Dr. Lauer talks about how porcine valves are preferred even today over mechanical valves because anticoagulation requirements can be problematic. Yeah, okay, so even today that may still be true that porcine valves are preferable, and in most poskim we're not particularly concerned with the fact that this Haredi rabbi made the additional point, the story I started with. This Haredi person made the additional point that the issur is to eat pig. There's no issur in having porcine tissue inserted inside the body. So there are some poskim who actually are concerned with transplanted tissue of non-Jews and maybe of treif animals. I'm not sure, but the halacha certainly there's no problem with having tissue of a non-kosher animal injected into your body. Okay.
Thank you, Rabbi.
So
Thank you.
Thank you so much. So I
Great.
tried to get most of the questions in the chat. If anyone has anything else, I'm happy to take it. If you can feel free to email me afterward also, we can continue the discussion afterward. I don't have all the answers, but I'm always happy to listen to questions. So thanks all again for listening and for participation, and glad we had this opportunity. Thank you again to the organizers and the Choli for putting this together.
Thank you.
Yes,
Thank you.
Thank you so
Thank you
much.
so much.